Why is it important to talk about hypoglycemia or low blood sugars? Hypoglycemia episodes are not good for someone's heart or brain, and they can cause defensive snacking, leading to weight gain. One single episode of hypoglycemia leading to hospital admission can be very expensive for a patient, and it can have real negative impact on quality of life. In a diabetic person, if the blood sugar level is less than 70 milligram per deciliter, is usually called as hypoglycemia or low blood sugar. Now, this can be with symptoms or without, and the symptoms can be anywhere from just feeling a bit weak or lethargic and dizzy to something like feeling anxious, nervous, a bit shaky, and having palpitations or fast heartbeat, sweating, or even tingling and numbness. If the blood sugar level is dangerously low, then patients sometimes can have seizures or fits and go into coma. Some patients do not have any symptoms of hypoglycemia at all, and we call it hypoglycemia unawareness. Now, this could happen in somebody who has had diabetes for a very long time, or somebody who was having hypoglycemic episodes repeatedly in the past, so that their bodies are actually unaware or they stopped sensing the low blood sugar altogether. If you see somebody having these signs and symptoms of hypoglycemia, or you yourself are experiencing these symptoms, then the first thing to do is to sit the person down. Check the blood sugar level if you've got a glucometer handy at home. But if you haven't, then it's better to assume that the sugars are low and just treat it as hypoglycemia. Remember, a little bit of high blood sugar later is less harmful than low blood sugar. So once you check the blood sugar level, if it is below 70 milligram per deciliter, then remember 15-15 rule. Give 15 gram of quick acting carbohydrates and recheck the person's blood sugars 15 minutes later. Now, this is very important, and often patients or relatives or people around the person forget to recheck after 15 minutes in that panic situation. This is important because if 15 minutes later that person's blood sugars are still below 70, you still need to give him fast acting carbohydrate again. So repeat this cycle until the blood sugars are more than 70 milligram per deciliter. So what are these quick acting carbohydrates which are easily available at home? Let's have a little look at the list. So you can give about 3 to 4 glucose tablets, or the best and easily available is 3 to 4 teaspoons of sugar, honey, or corn syrup, or 4 ounces or half a cup of fresh juice or regular soda, not diet soda, or 8 ounces or a cup of non-fat milk, or 2 tablespoons of raisins, or if you've got hard candies or jelly beans, always see the food label, but usually about 4 to 5 should be enough. So after giving 15 gram of quick acting carbohydrate, remember the 15-15 rule. Check the patient's blood sugar 15 minutes later. Make sure that they are above 70 milligram per deciliter. And then don't forget to give some long acting carbohydrates such as a piece of toast or a meal if the patient is due to eat. Now, this is going to prevent this patient having low blood sugar later on in the day. Now, all this applies if the patient's hypoglycemia is mild. Severe hypoglycemia is where someone's blood sugars are dangerously low and the person is unable to treat himself. So he needs help or assistance from others to help him recover. Now, this can be quite a dangerous situation. Here, something called as Glucagon nasal spray or injection can be of use. The problem with Glucagon injection or spray is availability and cost. Glucagon is a hormone which helps to raise blood sugar levels. Now, the safest option is if you're not sure if the patient is able to swallow or talk properly or is semi-conscious, is to call ambulance or take the person to hospital. Never force to eat or drink because that can be more harmful to the patient in case he chokes. One episode of hypoglycemia, you must take it very seriously and try and understand why it happened. Was it because of too much of insulin or maybe insulin and food mismatch? Or was it due to the fact that you were fasting or having very low carbohydrate in your meal and still took your usual medications? Now, certain drugs that we use for diabetes management, like sulfonylureas, commonly prescribed as gliclazide and glimepiride, can cause more hypoglycemia than other drugs. Certainly, alcohol can be one of the triggers, or even exercise is not an uncommon reason for hypoglycemia. So, you must know what type of snack and how much to eat before exercising. Certain patients, like elderly or those who have had kidney problems, are more prone to get hypoglycemia. So, you really need to discuss this all with your doctor in order to prevent future episodes happening.